Hi, my name is Anna. I am a second-year MPH student with a concentration in community health and health behavior. I also work as a teaching assistant for undergraduate public health courses and a graduate student ambassador for the School of Public Health and Health Professions at UB. I think that the topic of community was chosen as a theme for National Public Health Week because community is an important aspect of public health. We know that many factors influence health, such as where someone lives and what their social circles are. These are both parts of community that you are a part of. Zip code, or where you live, can help to predict positive or negative health outcomes. So for example, some people living in a certain zip code can have a higher rate of certain cancers as compared to people living in a different zip code. The same goes for your social circle or the people that you interact with. If you surround yourself with people who make healthier choices, you are more likely to make those choices for yourself. So another example, if you are surrounded by friends and family who choose to eat healthier foods or participate in more physical activity, you are more likely to also make those choices for yourself. So eating healthier foods, participating in more physical activity, compared to if you surrounded yourself with people who did not participate in those things. Whether these are active or passive choices is another conversation, but if you surround yourself with people who make healthier choices, you are more likely to make those choices for yourself as a part of the community that you're a part of. So one thing that I want people to know more about this topic is that it can be what you want it to be. Community is defined as a group of people living in the same place or having a particular characteristic in common. So this can become something as broad or as narrow as you want. So for example, community can be defined as the people living in one zip code, or the people living in one city, or one town, or one state. Community can also be defined as the people working in one office, in one location, or the people having the same hair color. Again, something can be as broad or as narrow as you want. You can choose the community that you want to look at based on what you want to define it as, which is something that I think is nice about the community and characteristics of communities. So things can be learned from looking at different communities and by defining communities in different ways, and sometimes there can be different observations that can be found. So one way that people can get involved in this topic is spending time volunteering in your local community. So by doing this, you're not only helping out in the community, but you're also making connections with the individuals that live there. So many times you learn about their lives and what goes on in the community, including what they are good at and what they can be struggling with. This can help in the aspect of public health because you can either be doing research on what the community, different health outcomes of the community, as well as different health behaviors of the community. You can be looking at the positive and the negative, and by being in the community, you're getting real data from real people with their real lives and what they are either doing good at or what they can be struggling with, what they may be needing help on, and what they could be helping people with. Another way that people can get involved in this topic is by going to various community meetings. So this can include board meetings or block club meetings. Again, at these meetings, you make connections with the community and learning more about them and their lives. Thank you.